We have a bunch of questions about when are things going to be normal, and in particular specific situations. So will summer camp be open? I'm planning to go to college in the fall. What's going to happen in the fall? I fielded one this morning from a neighbor who wanted to know if we could plan a large community event for late in the summer, an outdoor community event. Somebody else asked, when are we going to be able to have social events like weddings or bar mitzvahs with 100 or so guests? So any thoughts on when? I'm going to preview the answer. It's complicated.
Yeah, and I think everyone, as folks know, it's phased, right? So I just read this morning a really nice report put out by the Johns Hopkins Center on Global Health Security. They're the folks who have been doing a dashboard that's been well received, and they stage it, right? So like the large event of more than 50 people, I think we just can't plan on that happening for a while, right? I think a small event of 10 people outside where everyone's 6 feet away, that's going to happen first. And again, there's some directions in the federal phasing, but I think we just have to use our common sense too, right? Like in a large gathering, there's a lot more exposure. So college, I think that's TBD for the fall, honestly. I think most people are suggesting it's probably, well, I don't want to get too far out over my skis, but if you think conceptually about what college is like in terms of exposure, you can see it being a later phase. I might let Jen speak to this, but yeah, so I think a phased approach.
Yeah, I was just going to say, Jen, you want to talk a little bit about social networks and how we can think about risk?
Yeah, I guess first I'll also just talk about in general about the timing. I think it's true that, people really want an answer on that. And I think it's going to change every couple of weeks because we're learning so much, and from different parts of the world as well. I think the fact that parts of Asia are, they're not going back to the way life was before, but they're going back to some semblance of regular life, but with a lot of kind of the more basic social distancing and public health measures baked in. So I think we're going to learn a lot in the next few weeks from that. But I think it's absolutely right that it's going to be gradual, and then we're going to have to reevaluate, every couple weeks as we introduce kind of more contact. But yeah, so my research group so I'm not a social network scientist either, but we've done, one of my colleagues has done some work looking at how we might be able to use insights from social network analysis going forward. The fact that we might not have to limit all social contact, but kind of the things we started recommending early on, that if you can limit your social networks to groups that have repeated contact with each other in a more isolated way, when you take that across the whole population, it really does reduce the overall risk of transmission, of more distant transmission chains. So I think we're going to have to think of more concrete strategies that can be sustainable over the long run for reducing social contact. And I do think that makes school and college, particularly tricky, because that automatically, increases dramatically the number of social contacts. But I have a senior in high school and thinking about college. So it is heartbreaking to think of these kids not being able to go back to that environment. And so I do think there's still a lot of time between now and July or August when the universities will make those decisions. But if you want to be cautious, you might want to start thinking of some alternatives, I think, for the fall, if you don't want to do online college, which is, less than ideal.
I have some other thoughts to add, just on the immediate things that we're probably looking for to indicate that we could enter phase one. Like, we should be looking for sustained reduction in cases in a given area over a 14-day period. Many of the places where the outbreak is happening in cities, we're sort of still either climbing the peak, or we definitely haven't descended all the way, the peak that we've been trying, or the curve we've been trying to flatten. And so that's one indicator that people are recommending that, we should be looking for consistent reduction in cases and decrease in that slope of the curve. And then those other points that we mentioned before about capacity for testing to be ramped up in your locality, the influx of resources around contact tracing, like those are some of the things that will be necessary to even consider entering phase 1 reopening, right? And then it will have to happen in a sort of staggered, slow, deliberate way so that public health workers and epidemiologists can say, okay, we did this, now are we seeing a surge in cases or not? Is it a surge that we can handle both from a contact tracing and testing capacity as well as a health services capacity, right? So these are gonna be some of the trial and error that has to happen as local governments almost experiment with different ways to reopen society. And it's going to take patience and a little bit of learning as we go along to understand what the best course of action is.
Yeah, I just want to signal boost what Amanda just said. I think I've been telling a lot of people that the things we need to see, a lot of people, probably the most common question I'm getting right now is when are we gonna, is it, okay, the governor just extended the safer at home order. Is it gonna be extended again? When are we gonna get out of this? And I don't know when. I don't have a crystal ball either, but I think what we're looking for is for there to be, as Amanda said, a sustained decrease in the number of cases over about a 2 or 3 week period. We also need to see that the healthcare system is below capacity and can handle another wave of an outbreak. And we need to see testing available to anyone who has reasonable suspicion of exposure, including people who have no symptoms or are just a little sick at home. We don't have that yet in most places. And we need to see the ability for the state or local public health agencies to be doing contact tracing, which is an incredibly labor-intensive process. And it can't be done on a lot of cases. It cannot be done large scale because it's so labor-intensive. So we need there to be very few cases in order to do that. So there are a number of components that I think, as Amanda said, need to be in place before we can start phasing out the safer at home.